management of your patient. Now, those individuals that you suspect or possibly predisposing factors such as Ehlers-Danlos, Marfan, hypertension, always keep in mind, well, what's going on with my anterior portion of cervical volus? Patients suspecting of having SAH should have, of course, a non-contrast CT of the head. 4% of CT scans are unfortunately negative. And if the CT scan is negative, then you get into lumbar puncture. Now, before I move on, there's a topic that we did earlier when we looked at meningitis and then encephalitis. And I very clearly delineated the clinical differences between the two. We spent extensive time on lumbar puncture and what you can expect in your different findings in your CSF. And at the time, we talked about HSV encephalitis or meningoencephalitis. And at that point, I told you that if there is damage to the brain, that there's every possibility that you might find RBCs in your CSF. Now, let me ask you a question. Now you have subarachnoid hemorrhage, and you know for a fact the cerebrospinal fluid actually circulates where? Yeah, of course, subarachnoid space. So now say that there's actual hemorrhage there. No matter how many samplings that you would take, because what you're going to measure for here obviously is going to be what? Is it glucose? Not the obvious one. Is it protein? Not the obvious one. This is hemorrhage, please. So what's the obvious count that you're going to look for? RBCs, right? Are we clear? It's hemorrhage. So use common sense in terms of your clinical judgment and suspicion. Now, if there's constant bleeding taking place into the subarachnoid space, I don't care how many samples you've taken, 1 through 4, you're going to find RBC counts to be high from the first to the fourth compared to when it's something like trauma, in which if there's trauma, there's every possibility that the RBC count might start dropping. But subarachnoid hemorrhage, not the case. You continue having high RBC count. Patients with positive CT scan or lumbar puncture should have a angiogram. You need to check out and confirm what exactly is causing the subarachnoid hemorrhage. This is an important topic of management of your patient. There's something called Hunton-Hess scale. Asymptomatic or mild headache, moderate to severe headache, nuchal rigidity. As we go through this, you'll notice that we finally get to scale of 5, patient comatose. Please know at this point, as a general concept, that the Hunton-Hess scale will be something that you would expect to then scale, understanding as to how bad is my actual headache and hemorrhage and such.